Welcome, and thank you for watching. I'm Devin George, the Program Officer at Cribs for Kids. If you've joined us for our Safe Sleep webinars in the past, you know they are live, but also recorded for on-demand future viewing. Well, due to loads of storm damage and some ongoing connectivity concerns here in our city of Pittsburgh, we weren't able to offer this session live. But like all others, it will be available for viewing on our website and YouTube channel. Because we're not live, there also isn't an option for chat or Q&A, but you can always email us at info@cribsforkids.org, and we will happily get answers or address concerns. And there's something else a little different with this session. If you've joined our webinars in the past, you know that we typically open with a video that speaks to the webinar topic. Well, we have a great discussion coming up with our Safe Sleep Champion guests. Judy Bannon, our founder and CEO, is opening this hour to speak with us about changes made by the Trump administration and how Cribs for Kids is moving forward with your support. Judy?
Hello, and thank you for watching. I want to personally address what is currently happening in our country and the impact it is having on our organization, partners, and colleagues. Let me start by assuring you Cribs for Kids is here. We plan to always be here. Our programs and resources, like these Safe Sleep Champion webinars, remain available. We work diligently every day to safeguard and expand our efforts to reduce infant mortality due to sleep-related deaths and SIDS. While there are changes that seem to be announced daily coming from the government, let me speak to some national policies that are impacting our community and then share how we're strategizing to remain strong. Many of you know about the recent cuts to our national agencies. Let me talk about the two that most impact our work. Earlier this year, the CDC suspended the data collection of the Pregnancy Risk Assessment Monitoring System, or PRAMS. This halted the data collection for 2024 and suspends it for 2025 and beyond. PRAMS data identifies groups of women and infants at high risk for health problems, measures progress toward improving maternal and infant health, helps those working in the field to prioritize interventions, and evaluates program effectiveness. PRAMS is also used by state and local governments to plan and review programs, as well as policies, to reduce maternal and infant mortality, making the best use of our health resources. This is no longer available. Then on April 1st, the U.S. Department of Health and Human Services dismantled the Eunice Kennedy Shriver NICHD Office of Communications. This closure terminates the Safe to Sleep campaign. If you visit the campaign's website, you can no longer order their materials. The educational content remains, but will not be updated. Along with the closure of the NICHD Office of Communications, almost all 27 of the institutes and centers within the National Institute of Health were eliminated. We could not have imagined losing both the PRAMS data and the Safe to Sleep campaign. This is a major setback for our infant safe sleep community. Next are the tariffs. As you know, Cribs for Kids has a unique model. We do not rely on federal grants to fund our organization. Instead, we manufacture, distribute, and sell at a value price infant safe sleep products like our Cribette Play Yard and Snoozette wearable blankets. The proceeds from the sale of these products to departments of health, hospitals, and other nonprofits fund our free programs like our hospital certification and National Public Safety Initiative, as well as our education, such as our Safe Sleep Ambassador and photo module. Our products are manufactured in China. In fact, 75% of all baby products are manufactured there. This includes our Cribette, Mini Cribette, and Safe Sleep Sammy and Sasha. Although the administration has lowered the tariffs from 145% to 30%, this is just a 90-day reprieve. Regardless of the percentage enacted, Cribs for Kids must pay these tariffs when the goods arrive in the United States. Tariffs are charged to the importer. As a nonprofit, we cannot absorb these costs and, in turn, must raise the price we charge to our partners. All of this is happening while our partners find themselves facing funding cuts. Because this is just a temporary 90-day pause, Cribs for Kids is preparing for an unknown future with regard to tariffs and funding. Here are some of the actions we have taken. First, we have reviewed every line item of our expenses. We have limited travel, made personnel changes, and reviewed our contracts. Second, we are supporting the Juvenile Products Manufacturers Association as their team actively works to secure tariff exemptions for infant products. Next, Corbex, our manufacturer, is strategizing with our factory to reduce manufacturing costs, making minor design modifications. These modifications will allow more crevettes to ship in a single container. They are also investigating newly available factory options in Asia outside of China, but this will all take time. Finally, we are asking, now more than ever, that partners who purchase their infant products from national retailers consider purchasing from Cribs for Kids. The prices of our products are commensurate with national retailers, often with more features, and always with the ABC Safe Sleep message. And it should give you peace of mind. Purchasing from Cribs for Kids supports our shared mission instead of enhancing the bottom line of corporations. As you know, all of our educational materials and programs, like this webinar, are free to our Cribs for Kids partners. This only can be sustained by the purchase of our infant safe sleep products. Before I close, with the loss of data and ongoing changes to programs, I want to point you to a couple of resources for up-to-date public health information. In response to the CDC removing data, the American Medical Association is now providing public health data and offering resources. You can visit their website to stay up to date on public, maternal, and infant health. You can also sign up to follow MedPage Today at medpagetoday.com. Another evidence-based source of information is your local epidemiologist. You can follow her pages on social media or subscribe to emails at yourlocalepidemiologist.co. Thanks to your support, not only will Cribs for Kids continue our work, we will continue to grow. We are launching our new professional training series this summer. We will hold our Safe Sleep Champions quarterly webinars in July and October and debut an updated Safe Sleep Academy this fall. Again, all of this is only made possible through the sale of our Safe Sleep products. If you have any questions, please email us at info@cribsforkids.org. Thank you for the opportunity to share our message and plans. What we do only works because of what you do.
Thank you, Judy. While these are tough messages to deliver, we are so grateful to have this platform to reach our like-minded colleagues. Okay, now we're going to switch gears. To those who have joined us for previous session, this will look a little more familiar. So welcome to the Spring Cribs for Kids Safe Sleep Champions quarterly webinar. As I said earlier, my name is Devin George. I'm the program officer here for Cribs for Kids. Following Judy's address, today's webinar features the work of the American Academy of Pediatrics, the AAP, and Infant Safe Sleep, Beyond the Recommendations. We welcome two Safe Sleep champions from the AAP, Bonnie Kozial and Dr. Elizabeth Murray. We're going to talk about the resources the AAP offers to its members, safe sleep advocates, and families to support safe sleep to reduce infant mortality by preventing sleep-related deaths. But first, I'm going to do a catch-up on what Cribs for Kids has been up to this year beyond what Judy reviewed. So here we go. Since our January Safe Sleep Champions webinar, you may have seen Cribs for Kids presenting at events around the country, at the SID Summit in Seattle, where we virtually presented our Safe or Not Safe photo module to conference goers. Or at the Child Maltreatment Conference here in Pittsburgh, we presented our professional training module for child welfare professionals, Your Visit Could Save a Life. And we're going to be talking more about that one in July's webinar. And we were also pleased to present to members of Tennessee's Safe Sleep Collaborative. So that was a lot. Following Judy's address, today's webinar features the work of the American Academy of Pediatrics, the AAP and Infant Safe Sleep, Beyond the Recommendations. We're welcoming two Safe Sleep champions from the AAP, Bonnie Kozial and Dr. Elizabeth Murray. We're going to talk about the resources the AAP offers to its members, advocates, and families that support safe sleep to reduce infant mortality by preventing sleep-related deaths. But first, I'm going to do a catch-up on what Cribs for Kids has been up to this year beyond what Judy reviewed. So here we go. Since our January Safe Sleep Champions webinar, you may have seen Cribs for Kids presenting at events around the country. We were at the SIDS Summit in Seattle, where we virtually presented our Safe or Not Safe photo module to conference goers. We were invited to present to members of Tennessee's Safe Sleep Collaborative. We were so happy to meet with all of those folks. And then we also presented at the Child Maltreatment Conference here in Pittsburgh, where we're presenting what you'll hear more about in July, which is our first professional training series models for child welfare professionals called Your Visit Could Save a Life. Then in March, we honored Nancy Coles, former executive director of Kids in Danger, with the Making a Difference Award at our 18th Annual Women of Achievement Awards. This national award recognizes individuals who spent their lives and careers in the service of others. Nancy's work has made a lasting impact on countless children and families. She remains a tireless advocate for children's product safety, raising awareness of the risks of unsafe infant and children's products. At the awards ceremony, Nancy was joined by those whom she has served as a role model, shown here with Courtney Griffin, Michelle Berry, and me. For Nancy's professional achievements and unwavering commitment to babies and children, Cribs for Kids was honored to honor her. At the Women of Achievement event in March, we also announced the Barbara Clemens Emergency Relief Fund. On April 17th, 2020, Cribs for Kids lost a cherished member of our team to COVID-19. Barbara Clemens, our Director of Product Development for 14 years, was a dedicated advocate for infant safe sleep. She was instrumental in responding to emergency relief efforts, ensuring that infants in areas impacted by disasters had a safe place to sleep. She worked tirelessly coordinating shipments of cribs and other safe sleep products to emergency responders around the country, including Louisiana's flooding in 2016 and Hurricane Harvey in 2017. To honor Barb's legacy, we established the Barbara Clemens Emergency Relief Fund. Kicking off this initiative, Corbex International, our manufacturer that Judy mentioned earlier, committed to an annual $5,000 donation to support her fund to provide cribs to emergency shelters and relief agencies. We welcome donations, particularly in light of the recent FEMA fund reductions, which are easily made on the funds page on our website shown here. And finally, JPMA Cares. Earlier last year, JPMA Cares invited Safe Kids Worldwide and Cribs for Kids to form a Safe Sleep Collaborative. Part of this collaboration promised our first Building Blocks mini grant program. Opening on March 1st, we invited applicants to receive 40 Safe Sleep survival kits and other Safe Sleep program support. The application period just closed on April 30th. We are overwhelmed to have received over 200 applications. I mean, wow, thank you. And to those who applied, we'll be working to announce those awardees in June. Until then, we invite you to check out the Safe Sleep resources that are offered by JPMA Cares and their amazing Baby Safety University and Safe Kids Worldwide Safe Sleep Safety and Suffocation pages. More great options for safe sleep support and education. And we're going to talk a little bit more about other options for safe sleep support and education with our guests from the AAP. Bonnie Kozial and Dr. Elizabeth Murray. We're going to learn how the AAP helps us when it comes to talking about unsafe sleep deaths in the media, something we learned is lacking in January's webinar. And before I introduce them, a reminder that we aren't taking questions live because we aren't live. So please do send an email with any questions or concerns regarding this webinar to info@cribsforkids.org. Now to our guests. And welcome to our Safe Sleep Champions from the American Academy of Pediatrics. Bonnie Kozial is the Manager of Injury, Violence, and Poison Prevention. Her name is likely familiar as she's a longtime leader in the field with more than 24 years of experience. At the AAP, she manages a lot. The AAP Council on Injury, Violence, and Poison Prevention, and the section on child death review and prevention. They are the expert pediatrician groups that develop evidence-based policy and lead education, advocacy, and implementation work around injury prevention and fatality review, all where sleep-related deaths sit. While an expert on safe infant sleep promotion, other topics of focus include unintentional injury, violence prevention, and gun safety. Bonnie works to translate policy into practice and engages across sectors to ensure impact. This includes pediatrics, community-based organizations, public health, early care, education, primary, and specialty care. See, a lot. And we are also joined by Elizabeth Murray. Dr. Murray is the Director of Child Health and Safety Communications at Golisano Children's Hospital, University of Rochester, a Gold Infant Safe Sleep certified hospital. She's board certified in pediatrics and pediatric emergency medicine and is an associate professor in both departments of pediatrics and emergency medicine at the University of Rochester. Within pediatrics, Dr. Murray is one of 2 child abuse pediatricians caring for children in the REACH program. She also sits on her county and state's child fatality review committees. And in 2014, Dr. Murray was named a spokesperson of the American Academy of Pediatrics. Welcome to you both, and thank you so much for making the time to do this different version of our Safe Sleep Champion recorded webinars. So for the next 40 minutes or so, we're going to go beyond the AAP's safe sleep recommendations and talk about how the AAP supports its members, communities, and families when it comes to reducing sleep-related deaths. Okay, so Bonnie, so happy to have you here. Let's dive right in. Can you walk us through a bit of the history of the AAP and SIDS and SUID?
Sure, thank you. So in the early 1990s, there were some epidemiologic reports out of Europe and Australia that sort of indicated that a change in guidance around infant sleep position was needed. So the task force on SIDS was convened in the early 1990s to review those reports. And they issued their first report in 1992. So that report recommended a non-prone sleep position, so either supine on the back or side sleep for babies. And then, as a little more time went by, the evidence around this expanded. So it became clear that side sleep was not as good of an option as supine because a baby on the side can roll into a prone position. So the recommendation evolved a few years later to supine only. And since then, the evidence base has really grown a lot around a lot more topics, right? So now we have recommendations around things like more details of the sleep surface and sleep environment. We talk about feeding human milk, offering a pacifier, avoiding smoking and nicotine exposure, avoiding alcohol, marijuana, other drugs, and overheating, getting prenatal care and vaccines. So we have evidence around a lot more things now that can affect an infant's risk of sleep-related death. And so these are all topics that are addressed in the most recent policy statement and technical report, which were published in 2022. Those will be due for review in 2026. So depending on what is new in the literature, a new revision might be initiated then. The task force is comprised of about 8 to 10 pediatrician members who are experts in this field. We also have liaisons from some external partners, including the National Association of Medical Examiners and some federal agencies, including the Eunice Kennedy Shriver National Institute for Child Health and Human Development and the Centers for Disease Control and Prevention. These are all the people who were involved in the most recent policy statement and technical report. Obviously, there have been a lot of changes in the federal agency landscape since then, so it remains to be seen what this group will look like when they reconvene to think about revising this statement.
And the task force now has transitioned into a subcommittee, correct?
Correct. So at the AAP, a task force is the term that we use to describe a group that comes together sort of temporarily to address a specific problem and carry out a certain task, and then they are disbanded. And in the 90s, when this first became a topic of discussion, it was thought that really what we needed to do was issue some recommendations related to the new evidence on sleep position. But as the evidence continued to grow and expand to different topics, it became clear really that this was not an area where we could do this once and have taken care of it. So the task force now is the Subcommittee on Sudden Unexpected Infant Death. They are a subcommittee of the Council on Injury, Violence, and Poison Prevention. And the reason for that transition to bring it under injury prevention is to reflect that there are a lot of things that families can do. There are a lot of things we can do to reduce the risk and to prevent sleep-related deaths. And of course, through SIDS is real. It's a thing that exists. And, you know, that's what we don't necessarily understand so well yet. But the things that we have seen that reduce the risk of SIDS also reduce the risk of SUID and vice versa. So prevention is a thing that all families can do, and they need guidance on how to do that.
Right. So this seems to be a positive development for those of us working in infant safe sleep. The recognition of the AAP in this area, as you said, moving it towards prevention, because there are things we can do. And as you said, SIDS is real. We don't know what causes it, but we do know if we follow safe sleep, not only are we preventing suffocation and asphyxiation, we're also doing what we can to prevent SIDS. So it's a real twofer that we like to focus on. So you mentioned that agencies like ours, you know, well, you didn't mention, I'm mentioning now that agencies like ours, we root all of our education and our work in what those AAP recommendations are to follow infant safe sleep. And we know that that subcommittee is going to gather again, you said, for 2026 recommendations, and that really seems to be right around the corner. We do know it'll be a little bit different, right, as we don't have the NICHD, as Judy mentioned at the start of this webinar, but we do still have great bodies of evidence. And so can you tell us kind of about how you think, you know, what that timeline is like when the subcommittee will get together and when the recommendation, because it's not just kind of like, oh, well, it's time and we're just doing this to do it. It's pretty methodical, right?
Yes. So when they convene in 2026, they will come prepared with a discussion of what is new in the literature since the current versions were published in 2022. And depending on what, you know, if there are new pieces of evidence that point us to maybe a different recommendation or an additional recommendation, or maybe some further refinement of recommendations that we already have, those are things that they would want to reflect in a revision. There's also been a lot of activity on the product side, so sleep product regulation. There was the Safe Sleep for Babies Act, and you know, regulatory actions around specific products like infant nursing pillows are just now subject to a new standard that kind of makes it clearer that they should not, that a baby should not be put on a nursing pillow for sleep, and that making those look less like a place where a baby could sleep. So there may be some outcomes data, some information about the impact of that work. And, you know, certainly there are programs that might have evaluation data that could point us toward a good model for programs that could be recommended, lifted up for dissemination to others. So my sense is that they probably will initiate a revision. Those revisions are not quick. We have a very long methodical process, and the purpose of all that is to ensure that what we publish is the best possible summation of evidence and recommendations. So the typical timeline is about 2 years. Depending on how efficient the group is, it can be a little bit faster or a little bit slower. And there are also some considerations that are out of our hands, like the World Health Organization is intending, as far as I'm told, to make some changes in recommendations for coding of infant deaths. And so that might be something that they, you know, if that happens before this revision, then that would be reflected there as well. So the timeline for seeing a new version is probably not before 2027.
Okay, thanks for that. Yeah, and the important takeaway on that is that the recommendations evolve based on evidence, and it's a collaborative process, right? And that's what makes for success and meaningful work. So we look forward to that. So we're talking today about, outside of those recommendations, what the American Academy of Pediatrics offers to its members, to its communities, to its families. So one of those things that I know that you guys do is the National Collaborative for Safe Infant Sleep, the NCSIS. gathers a lot of like-minded agencies and people together, again, collaborative, right? So can you tell us a little bit about some of the groups and people involved and what's been happening in the past couple of years? And you can see what's been scrolling on the screen is a page that's on the AAP's website that speaks to some of this work. So do you want to share some of that with us, Bonnie?
Sure. So the National Collaborative for Safe Infant Sleep is a component of the Suicide Prevention Program. This is a cooperative agreement that came to the Academy from the Health Resources and Services Administration, Maternal and Child Health Bureau, so HRSA and CHB. And the three main activities of this cooperative agreement are increasing dissemination and awareness of safe sleep recommendations, convening the collaborative itself, and then promoting and supporting pediatrician involvement in child death review and fetal and infant mortality review processes and teams. And the utilization of fatality review data, because there's a lot of very rich qualitative data in the fatality review system that can help us understand how to do a better job of supporting families and preventing sleep-related deaths. The collaborative itself is a convening of in the neighborhood of 25 organizations dedicated to safe infant sleep. Our charge from HRSA was to convene national organizations. So this is not including, county level organizations or state level. These are national organizations, except in the cases of some state health departments who are there because of their work in the fatality review systems. And the purpose of the collaborative really is just to ensure that the work of this cooperative agreement and of the safe sleep community at large is disseminated to partners who can help carry out the work in communities and supporting of families. It is to sort of lift up some of the science and ensure that the safe sleep community is really well informed about changes in the evidence base and ways that they can be supported and do a good job supporting families that they serve, that are their constituencies. So that is a group that is an audience for a lot of the resources that we've developed. We have had some really great presentations to that group from Rachel Moon. Most recently gave a talk about her work in how you change parents' impression of what all the other parents are doing. So social norms theory as a way to encourage safe sleep behaviors. We've had presentations about product safety issues. We're putting a lot of work into supporting pediatricians, but also just the community at large, understanding what requirements apply to infant sleep products and how to report products that are not compliant, whatever scenario it is that you encounter that. And we also have done a lot of partner highlights. So during these webinars of the collaborative, we would ask one or two partners each time to come and sort of talk about what they do. So Cribs for Kids did this. We've had presentations from Kids in Danger, which talked about their product safety work. I'm going to get the name wrong. It's an organization that provides support to early care and child care settings. And just, yeah. So all the partners who are part of this, we've been rotating and trying to give everybody an opportunity to highlight their own work for the edification and benefit of the group at large.
They're great. I really look forward to those webinars and the e-newsletters that come out of it. And it is, as you said, reaching out beyond the providers, and bringing that community together. So it's good to just see a lot of familiar faces on there and be able to connect even through that NCSIS group. But so you do offer specific things to providers, though, that are more geared towards clinical engagement and encounters for folks like the work that Dr. Murray does. So if I go to the AAP.org and put safe sleep in the search bar, I get a great page. So we're going to show that a bit here. Am I showing it there? Yes, great. So why don't you walk us through some of those resources that are there and how they might use them?
Sure. So if you, there's an alias for this, it is aap.org/safe-sleep. So that is another way to get to it. From the top, we have a brief summary of where to find the recommendations. So if you are looking for the current policy statement and technical report, they are linked right there. There's a link to the suicide prevention program, which has some program-specific items. And then a little bit farther down, so there are links to this provider and patient conversations module. This is a series of 5 or 6 videos, sort of showing how to translate the recommendations into a conversation with a family. This is in a clinical setting, but I think there are a lot of nuggets here that would be really helpful for just a peer-to-peer conversation as well. You don't have to be a pediatrician to learn things about how to talk about safe sleep here. And it's really sort of operationalizing the recommendations in the context of real challenges that families face. So things like the baby just won't sleep, the baby is congested, just problems that families encounter and how to problem solve with them. And next to that is the other item that I would really highlight, which is a link to the Safe Sleep campaign that the Academy has posted. These are all, so if you click on that link, you would get a whole page full of social media assets. So graphics and videos and things that that anyone at all is perfectly welcome to download and post. You can slap your logo on, you can do whatever you like with those. Those are available for use by everyone. And then we have some professional courses. There's a PediLink course. This is a CME bearing course specific to safe sleep in childcare settings. So that can be used for training of childcare personnel. And then the newest item there is an EQIP course. EQIP is the Academy's Maintenance of Certification Part 4 product. So MOC Part 4 is a quality improvement activity that pediatricians have to complete on a fairly regular basis in order to maintain their certification. And this is the enduring online version of a live course that we piloted in 2021. It was called Safe Sleep and Naps Using Guidelines to Lead and Educate, or SNEGGLE. And it was a way to support pediatricians in sort of practicing those clinical encounter skills. So how to have a productive conversation with families and guide them in a way that addresses their concerns and empowers families to do the best they possibly can around safe infant sleep. So that is the newest product that we have available there. And there are some links to other helpful resources as well, including the Great Futures tools, which are product supports that can help sort of reinforce messages that you talk about in the exam room with a written version that parents can consult later.
Yeah, I love those. Well visit forms are great. Because they do have a lot of great conversation starters, whether you're on a clinical visit or building an education module that will help people speak with families. And that provider patient conversation video series is great. We don't have the time to show one, but we encourage people to go out and take a look at them. You'll recognize a lot of people out there, Rachel Moon, and one of our favorites, Dr. Mike Goodstein. So again, as you said, showing how you take those safe sleep recommendations and build them into just a conversation to support families. And as we say at Cribs for Kids, if you can get to it on our site, use it. It's free. And it seems to be that that's the same thing. So while people like Dr. Murray might be your target, you still can go out and use those for anybody who's working in infant safe sleep. So this is, for example, the safe sleep, the conversation videos page. So you can see what's out there really interesting and good stuff, super applicable. But let's talk about, because you're not done, right? So with the Safe Sleep, sorry, we know you have some things coming up about some product image campaigns and image library you had mentioned. So this isn't all that's happening. So tell us some other new things that you guys are working on.
Sure. So starting actually next week is our first photo shoot. We will be developing an image library. I'm sure for the viewers of this webinar, it is no secret or surprise that most of the images you see out there on stock photo sites are have problems, right? So practices that would not be recommended, items in the bed environment that are not recommended, and so it's tough to find photos that really show safe sleep. And this is important, right? Because we know that what people see out in the world informs their impression of what the right thing is to do. So we are taking the opportunity to shoot some photos here where we are locally in the Chicago area of babies sleeping safely. You know, it's not easy to cast real little babies. So we're very grateful to the families that have agreed to participate. And, you know, hopefully the babies will sleep instead of, you know, lying in their safe sleep spaces crying. So this is an activity that will be finished. It should be posted within the first 2 weeks of July or so. So there will be a link at aap.org/safesleep to our image library. Those are photos that will be available for everybody. Again, everybody can go in and download and use those photos for their own outreach, for their communications, their websites, their, you know, printed materials, whatever the situation, whatever the case, whatever you may need it for, those will be there for use. And that will be also connected to, just a brief plug, a broader injury prevention image library that we are also developing right now. It's a very image library kind of spring. And the other activity that we have going on that we're really excited about is our Safe Sleep Champion Network, which is something that the Academy has to sort of support our chapters. We have champions on a broad array of topics. There are something like 25 champion programs. And so this year we have been piloting a Safe Sleep Champion Network with 10 AAP chapters to support them in again, raising awareness of the issue among their members, and also sort of bridging connections with their local fatality review bodies, because you really can find out a lot about what families in your state, your community, your county, whatever the case may be, from fatality review. And that can help you direct your efforts in a really productive and helpful way.
Yeah, the image library, we can't get enough. You know, Cribs for Kids, we have an image library and photography guidelines. And I know this is something Dr. Murray is going to talk about too but my favorite thing, and I kid when I say my favorite, is when you have somebody in the media who's doing a great story on infant safe sleep and how important that is. And then the lead image shows something that just makes your hair stand on end. You're like, oh, I say I could spend all day, every day emailing saying, thank you so much for your wonderful coverage. Could you possibly change that image? And here's a link. So it'll be great to have more links to send and more places that maybe we can crowd this out, right? Fingers crossed. And when we love our Safe Sleep champions, that's a great development. So that's kind of the provider side and what is geared towards those who were talking with families. But the AAP isn't just about providers or professionals. You guys have great resource for family. And one of our favorites to go to is healthychildren.org. So do you want to tell us again, this is, people might not even know that this is an AAP generated resource.
Right, so healthychildren.org is our parent-facing website, and there are articles here on, I mean, pretty much every topic you can think of. If there are things in the news, like right now, there have been, you know, articles about, you know, vaccine safety. Vaccines are safe, vaccines are proven. Getting the measles vaccine is a lot safer than getting the measles. and recent topics also, so autism, support for families with autistic children, and just acknowledging and understanding the value of kids with autism, and just sort of interrupting the discourse that has been going on lately. Around sleep, we do have a number of articles. So there's one, if you typed in healthychildren.org/safe sleep, that one is a fairly long article. It sort of outlines all of the recommendations and the reasons behind them. But then there are some more focused articles too. So last winter, when there was just a whole lot of RSV and other respiratory viruses going around and a lot of really congested babies out there, we posted an article about safe sleep when your baby is congested and has a stuffy nose. So in the past, sometimes pediatricians who meant well would give advice to like elevate the head of the crib, or put the baby in a semi-reclined device like a bouncy seat to sleep to sort of help with drainage. And that we know is not really good advice. So there's an article now about safe sleep when your baby has a stuffy nose, and sort of reinforcing that a baby's airway is really narrow, and a tipped head can sort of cut it off. And so when your baby is already congested and having a little harder time breathing, it's even especially important to keep that baby on a firm, flat surface to make sure that the airway doesn't get compromised anymore by head slump. And with some suggestions about how to clear out the crud so that your baby can sleep a little better and be more comfortable. We have, there are articles around lots of different safe sleep topics. And so, in that sleep section, the sleep section does include sleep content for older kids. So things about good sleep habits and things like that. But there's a lot of really great parent-facing advice on this website. And about a whole wide range of every topic that you can really think of.
And they can go and search that for information, but parents can also, it can be pushed to them, right? So if I'm a parent and I want to be sure I'm getting the latest or greatest, or if I'm a pediatrician or any kind of provider or working with families, I can also sign up for this, right? And get information pushed out. Tell me how to do that.
Sure. So at this screenshot, and really, I think it's at the top of all the articles, there's a link to log in or register. So you would click up there and you would come to this page that you have prepared here, and it's a quick registration. You can sign up there, and you'll get, there's a monthly newsletter that gets pushed out, and there are also parent webinars that happen from time to time on this platform around topics that are particularly of interest, maybe because they're in the news or there's new information or evidence, just things that parents need to know about. And there's also, within this website, there's an opportunity to sign up for a sort of a parent advisory committee. Committee maybe too formal, but it's a group that sometimes we will survey to find out, what parents are thinking about, what sort of challenges they're having. We queried this group when we were writing an article about gifts for new families. So besides, bringing them something to eat and, what are ways that you can support a new family to sort of refill their energy and their resilience so that they can be as well prepared as possible to handle the sleep disruptions that happen overnight. So things like, if they have older children, drop someone off at school, take them to the park, walk the dog, bring some food, come over and do some laundry, make sure you text, you let them know, don't just show up unannounced. Just, ways that you can support a family, because that helps, with sleep safety, right? Everything we can do for new families to help them feel just a little stronger and, more put together and thinking straight. Every way that we can help a family in those early days serves the purpose of safe sleep.
Yes, exhausted.
So we got some good ideas from that survey group.
Yeah, that's great. Much better than
Signed up through Healthy Children.
Much better than the tell me if I can do anything. No, here's some real things, actionable items, and we do know that exhausted, fatigued parents don't often make the best decisions when it comes to sleep. So again, free, actionable, sign up, all that good stuff. So, and that's not all the AAP does. So we're now going to talk to Dr. Elizabeth Murray. She is joining us to talk about another feature, how you can talk about infant and children's issues to the media and how more of us can do so. So when I introduced Dr. Murray, you heard about all the roles that she plays. There's a whole bunch of them, but the one that we're talking about first is her role as a spokesperson for the AAP. So Dr. Murray, let's just start by explaining what that is.
What a spokesperson is?
Yeah, how you become that, and you know,
how we're training a bigger cohort of people to be able to speak expertly on safe sleep. It turns out, pediatricians or nurse practitioners, people who work in this field, we're all pretty used to explaining things to people because we're constantly interacting with parents and caregivers. But I think when you say talk to the media, there's that kind of stigma or nervousness that goes along with it. And so the AAP over the past number of years has developed a number of different echo sessions. So these longitudinal hour-long training programs in a variety of different topics to help improve knowledge bases. And so the Spokespeople Echo series is originally, we did one during the pandemic. It was technically called Infection Control, but it was about how to speak about pandemics and what we were learning, at a fire hose in your face pace of knowledge sharing that needed to happen. Certainly vaccines as well as another one. And now we are in the middle of the Echo on training people to speak to the media about safe sleep, because again, this is a topic that isn't necessarily covered because these things don't necessarily always make the news. When the death occurs, it doesn't necessarily make the news. And so we have to kind of work to generate interest in this topic, except of course, all of us pediatricians know how critically important it is. So I think what we're seeing now is an outline of some of the sessions. Some of these sessions repeat from Echo series to Echo series because there are some, just basic techniques, basic things, regardless of the topic you're going to be speaking about, that you need to learn. But then certainly, obviously, having a good grasp on the data or the great ways to phrase important parts of the topic, especially when you have something like sleep that often carries a lot of historical information, right? We have grandmothers and great grandmothers and aunts heavily vested in giving advice. And so that brings a cultural component to it as well. And so, there's lots of things we need to make sure that we're speaking to from a base of knowledge, but obviously we want to be respectful of the cultures and the experiences that our patients and their families are living day to day. We want to make sure that our people are prepared. So how to, vet the different reporters. Of course, we are lucky enough to have the media relations team at the AAP who always will help with that as well. We have to cover the basics of what you need to wear, what you need to look like. Nobody likes to have those conversations, but certainly it is important. We need to dress the part, but we want to make sure that visually our people can be seen well and they have the knowledge base of what they need to wear. We don't want somebody wearing a green shirt if they're showing up to a studio that uses a green screen, because that will make them have a floating head and not see their body. We know that print-based articles are still popular, even though they might not be printed on paper anymore. They will be online in written form, and then certainly building the relationships. If you can make sure the news outlets in your community, and it might be a small city, it doesn't have to be becoming best friends with CNN reporters, but being known to the people in your community as an expert in a certain area of content can be great, because if you're a trusted expert in that one area of content, they might also come to you and say, hey, I know this isn't your thing, but I can trust you. Who would you recommend to speak on this other topic? And so building those relationships are just so critical. And then certainly social media is always an adventure as well. And getting information out there is so important, because we know a huge percentage of the population is getting all of their news strictly from social media now. So these are just some of the things that we go through. And again, this curtain session, it has that focus specifically on talking about safe infant sleep.
Yeah, I'm thrilled to be taking part of it. And when you talk about what to wear, I am regretting my light and dark here when I see your pretty pink. I'm like, oh, I should have. Yeah, I should have.
Like the jewel tones, right? It's all about the jewel
Right.
tones.
Yep, of course. So, and Elizabeth was very helpful because our tablecloth was not looking good here. So all of those things matter because if you're distracted, you're not hearing the message, and hearing that message is what's so important. So, and we know from our last webinar that we did with doctors Quinlan and Lowell that people aren't talking about these infant deaths in the news. They aren't, so we are so happy to hear that the AAP is taking these first steps to ensure that its members and other people who want to get involved in talking to the media are equipped to do so. And as you said, it's not, you're not on CNN. Oftentimes that local television, that local newspaper, even, podcasts, all of that helps to build that message, right? So we are so happy to hear that this is happening. And we've talked before about the struggle to get the media attention on the infant deaths, despite it being the number one reason we lose our babies, before more than the motor vehicle accidents up to age 19. So we know you have some experiences to share, Dr. Murray, about you as a spokesperson being able to do this and get some coverage for infant deaths in a unique way. So I'm going to switch to that slide now so you can share that with us.
Yeah, so you can be a little not necessarily sneaky about it, but you have to be vigilant, right? Because you can be creative in figuring out ways how to refocus media. They might very innocently or be trying to cover a topic that they think is important, but maybe their spin on it or their take on it's a little bit off from what you know to be the truth as a content expert. So we have an example here of one of our local reporters. Wow, this is a year and a half ago now. It doesn't feel that long ago. But we had a situation where a child died, unfortunately was murdered. And the reporter decided to kind of look into infant and toddler deaths. And, he kind of mentioned this with regards to homicides and some of the other deaths that were occurring in children in our community. And I was able to repost it with the data I wanted to get out because I knew we needed to talk about the unsafe leap deaths because I know that actually is the biggest killer of otherwise healthy children in our community. And so I just simply said, none of this is good news, though it's an important reminder that we lose more otherwise healthy babies to unsafe sleep conditions than anything else. Our rates in Monroe County are about twice the national average. And so I took a piece of, lived experience. I took a piece of data. I compared it to what we know to be true in the nation, because I think, especially when it comes to safe sleep, this is a really easy topic for people to feel like they can other with it, like, oh, that parent must have been drunk or they must have been this or whatever. They can kind of other it when in reality, we know these deaths are occurring to very loving, caring parents who are trying to do their best, and just a tragedy, a preventable tragedy occurs. And then the reporter full out acknowledges it. This tweet, caught his attention and decided to look into it. And then one of his colleagues then went to do one of the best stories I have ever seen about sleep products. Basically, it was about, a 4-minute story, and she chose for the whole, just about the whole time, she stood in front of a green screen and just constantly showed in the background all of the gimmicky stuff you can buy online, and none of it is proven. And her point was just, she had facts, she went through all this stuff, but just that visual of all the bad products that are out there that are sold with, almost, it seems like almost no regulatory effort on some of the platforms. And so it was a great visual. So that simple tweet brought 2 really great stories out that, had news coverage. They were posted online, so then they could be shared more on social media, and generated some good conversation within our community, and then took it a step further by adding that other story about sleep products and what parents what parents and caregivers need to know about the marketing associated with those. So,
Yeah.
Yeah.
I love that. It's clear why you've been a spokesperson for the AAP for so long. What a great way to respond and reach out like that, and the traction that you got. That's a great example, and anybody can do that, right? Anybody can do that. But and so thank you. And that's great. Yeah. And those products, man alive, we do some sessions on safe sleep products, and there's no safe to market requirement in the US for infant products. And, companies certainly take advantage of exhausted parents. And again, if you're out looking for the best thing for your baby, these babies, we're not losing them to neglect or abuse. These are loved on, cared for babies. And as you said, there's preventable accidents. So this is just a great story and a great example to share. So thank you for bringing that to us here today. And another one of our challenges, talking about sleep-related deaths, is the lag in the data. And we mean years, not months, right? So tell us about how maybe we could use more relevant and up-to-the-date data to talk about infant deaths.
Yeah, I mean, the medical examiners, it often will take them 6 months to, by the time they get the toxicology and all the various things back, it will take 6 months for them to reach a conclusion. And then what we found is, our health department is hesitant to release any information if there's only 1 or 2 of something happening, because they get worried that it could potentially be identifiable. And so you get that lag, and then the lack of, or the hesitancy to release it. And so what we have been able to do, and it's worked really well, is kind of have an agreement in our county with all the various agencies that we are allowed to publicly say how many unsafe sleep deaths are currently being investigated. So conclusion has not necessarily been made. In reality, we're just, the ME is just waiting on some little lab value to come back. We know what it is, but they haven't officially certified it yet. But we are able to say, in Monroe County at this point, we are currently investigating 8 unsafe sleep deaths for the year. And so that has been really, really, really helpful so that when we do have the opportunities to talk numbers, we can do it in more real time.
That's a great suggestion. We're going to try it here locally ourselves. So thank you for that. And we know we have people who are watching us who would like the opportunity to learn how to promote safe sleep in their community using local media, and they're not doing this echo classes. So are there other ways or tools that can allow them to feel a little more prepared or confident in going out and doing that?
Certainly, if you are a member of the AAP, there are various online resources. There's the social media toolkits that we've already talked about, but there are also on the website some kind of more generic speaking with the media training tips. We do offer various courses, otherwise some in-person courses, some 1-hour briefer educational segments throughout the year. Chapters certainly do this as well. People who are involved in chapter leadership are kind of technically automatically spokespeople, but we do have a process to train them through that as well. If you're interested, reaching out to the AAP media team is great. I will say also, and it might sound simple, but one of the best tips I think for people who are kind of starting out with this is go to that healthychildren.org site, see what it says, because it's accurate. It's written to a level that most people can understand. You can print out the page and then give it to the reporter you're talking to so that they have something tangible in their hands to refer to. If they forget to ask you something, they can also link that Healthy Children page in the online version of the article. So, there are some kind of self-made things, but the media team led by Susan Martin and her colleagues at the AAP are themselves a fabulous resource to help out.
That's great. Yeah. Again, more resources from the AAP. So thanks, you guys. Judy mentioned when she opened this about the closure of the NICHD's communication office in the Back to Sleep program, adding to the frustration that our numbers are moving in the wrong direction, up to now 3,700 infant deaths a year from suffocation, asphyxiation, and SIDS. So it's more than 10 a day, a shocking number of healthy babies. Given that, and we've done this on other webinars, and I'm going to give you both a chance, we want to ask you the magic wand question. So if you each had a magic wand that you could wave and end these suffocation and SIDS infant deaths, what would you wish for? You can jump in whenever you want.
I think, I guess I would wish for a couple of things. One would be that parents can walk into stores and buy a baby product and know that it is safe for the baby, or they can go online and buy a product and know that it's actually safe for a baby, not just these claims of safety or these claims of it will make you a better parent. I think we put a lot of additional pressure on parents by advertising these devices and all these other things to them that are really not grounded in science. And certainly if we could make sure everybody had a safe sleep sack or a wearable blanket at the time of discharge from the hospital, I think that would be great, great as well.
How about you, Bonnie?
Yeah, so I think I would wish for public policies that just prioritize families and the health and safety of children and babies. So things like paid parental leave so that you don't have to go to work and function in the morning when you have a 2-month-old that won't sleep. So you perhaps feel like you don't have to do those acts of desperation to get some sleep. Things like affordable and accessible high quality childcare and ensuring safe and adequate and affordable housing for families. And like Dr. Murray said, and this is a soapbox that I'm on frequently, just putting some teeth behind keeping those unsafe sleep products out of the public marketplace and just not allowing this free-for-all to create a product and advertise it and slip through a loophole and perhaps trick parents into thinking this is something they need or that would be a good idea or that would help them get that sleep that they have to have because they can't stay home the next day, things like that.
Yeah. So, and it's clear there's more than one thing that we need to do, which is why it's so important that the AAP moved the Safe Sleep to a subcommittee, that it stays there. It's under injury prevention. You offer those collaborative sessions with the NCSIS. People like Dr. Murray are out talking about it. We're gathering together for webinars and like-minded people. So we're just going to keep plowing ahead, right? More important than ever before. So thank you both so much for being here. I know it was kind of crazy recording and not doing live with the storm damage, but it's here. It's going to be out there for everybody to see. We are so appreciative of your time and expertise. So now we're going to do my 3 things at the close, right? If you've done this webinar before, you know we close our webinar hour with 3 things: a call to action, registration for our next webinar, and then we play our Safe Sleep Lullaby, Just Baby. So let me say your action item for this webinar is visit the AAP's Safe Sleep pages for professionals and their healthychildren.org site for families. Carve out 30 minutes or so to watch that provider or patient conversations for safe sleep. Check out the toolkit that's been mentioned a couple of times here, those form for the well child visits. Even if you're not a doc or an NP, there are great prompts in these forms to generate conversations around safe sleep and suffocation risk. And of course, sign up for the newsletter and webinars. So next is registration. I'm going to go back. I went too far. I think I'm going to go back on the slide. There we go. Is registration. Our Summer Safe Sleep Champions webinar, A Visit Can Save a Life, Safe Sleep and Child Welfare Professionals, will be on Thursday, July 10th at noon Eastern. Our champion guest is Dr. Rachel Berger. She is the first medical director for the Pennsylvania Office of Children, Youth, and Families. She's going to present a project that she's been leading in collaboration with counties across Pennsylvania, where we are, and Cribs for Kids, developing a specialized safe sleep training for child welfare professionals. So based on this work, Cribs for Kids team member Spencer Poston, our program and outreach manager, is going to debut the first of our Cribs for Kids professional training series. This one again for child welfare professionals across the country. We've been working on this for some time, about 1.5 years, and we are super excited to share this in July. That's Thursday, July 10th at noon with Dr. Berger. Registration will be open by the time you're watching this, since it's not live and it's recorded, so you can get that on your calendar. And we are confident we'll be returning to our live session. So again, thank you so much to Dr. Murray and to Bonnie. It was wonderful having you. I know that the people who are watching feel the same, and they've got a list of things that they're going to do after hearing you speak. So now we're going to go to Just Baby, a safe sleep lullaby. Like our safe sleep resources, it's available online at no cost. The song, the video, the music bed, the English and Spanish versions. Download a WAV file to use for your hold music or play across your unit or office. You can find that all on our partner resources portal that's linked on our partner menu website. Again, thank you so much. And thank you to those who are watching. The time and commitment you share with us is how we can be sure every baby wakes from every sleep. If you have a question and you weren't able to put it in the Q&A, but you are able, please, to email us at info@cribsforkids.org, and we will get that question off either to our guests or to Judy or to myself so that we can get you an answer. Again, thank you so much, and we hope to see you in July.
Blankets, no toys, just baby. crib. Bassinet or play-yard naps. No pillows, blankets, no toys. Just baby.